I think one of the perhaps or rather controversial studies that was presented was updated survival analysis for the POLO study. So POLO study was presented actually in a plenary session a couple of years ago in ASCO annual meeting that enrolled a patient with PRCA1 or 2 mutation with pancreatic cancer to be randomized after induction chemotherapy to either PARP inhibitor or observation. The primary endpoint of the study was progression-free survival, which actually was met. And the study was positive based on progression-free survival. And hence, the medicine Olaparib got approval, FDA approval in that indication. But the main question was, what about the survival, overall survival? So this year in ASCO GI 2021, the overall survival update was presented at the meeting, and it showed actually there was no overall survival benefit between the two arms. There was a lot of discussion whether, given the lack of OS seen in the study, whether patients should still pancreatic cancer patient with PRCA1 or 2 mutation should undergo or receive PARP inhibitor as a maintenance therapy. And I have to tell you, we asked that question on Twitter too, and there was a lot of discussion about whether it should use it or not. Some group felt it's actually should still be utilized in that indication as a maintenance therapy. Because patients sometimes need a chemo break, and it's good to use target therapy instead of chemotherapy to maintain disease control. But also there was some concerns that perhaps the lack of survival benefit was due to the crossover, that good percentage of patients ended up eventually to have PARP inhibitor after the progression. I don't think the answer is settled yet. I think it's, in my opinion, it's reasonable to use it for the right patient. But also, I don't think, especially around the world with cost of cancer care, sometimes could be prohibiting to be able to administer certain therapy. At least, there is no overall survival difference was seen in that study. Having said that, I think this was a landmark study, because now the next step we need to look at is how to better utilize target therapy for pancreatic cancer, and also what kind of combination we need to use, as well as better understanding of the resistant mechanism.